any research about health beliefs that people with CFSME may hold?
Yes, there's been quite a lot of research asking people with CFSME how they think about their illness and how they feel about it. And what you tend to find is that people have actually quite complex and sophisticated sort of personal models of the illness, and that they often recognise that many different sorts of factors may be involved in firstly starting with the illness and then maintaining it. So people recognise that there are physical factors like infection, but there are also factors like emotional distress and social factors. Clearly, if a person has had this illness for a long time without getting a diagnosis, and also if they've been to see the doctor on many occasions and have repeatedly been told, well, the tests have come back negative, we can't find what's wrong with you, they're left in a bit of a limbo, and people can get very frustrated and feel that they're maybe not even being believed. So I think that this can leave people quite open to looking around for other explanations. People can become quite desperate to find the explanation for what's wrong with them. And sometimes people latch onto explanations for which there's not really very good evidence. Sometimes you find that people have a lot of minor colds and illnesses and start to worry that maybe their immune system isn't functioning properly. But in fact, there have been quite a lot of studies looking at the immune system in chronic fatigue syndrome ME, and most of these suggest that if there are any problems with the immune system, they're very minor, and that they're probably related to other symptoms of the illness. So my view would be that as we do have an explanation for CFSME, and we do have some treatments that can be effective for CFSME, probably patients are better off at trying those treatments than spending their time and raising their hopes on treatments that aren't proved. Sometimes people try to control their fatigue with things like exclusion diets, or attempting to eat one set of foods and not another set of foods. The current evidence and advice is that these exclusion diets don't work, and that people should really try to eat a healthy, balanced diet, like just as we would advise for all people, really.